Lucas is a chest compression system that takes the human error out of CPR. We are fighting an uphill battle against what is most likely a severely diseased heart.
Check his pulse. Are we not feeling a pulse?
We need to get to the call really quick because if that person is experiencing chest pain caused by a heart attack, their condition can worsen very quickly.
Whenever we have a cardiac patient, we need to do a 12 lead on them. The 12 lead gives us a big picture of the heart. That would show us the electrical activity that's going on and if the heart is functioning how it should be. Hey guys.
So when we walk into the room, I notice that she's laying on the bed, which is not abnormal, but it's the way she's laying sideways.
Okay, so heart rate I've got here is 44.
It tells me that something's wrong with her.
But she was up and walking today and everything?
Oh yeah, today she walked a bit.
Pain is actually, she said, it's quite severe, but it's on the right side.
I doubt whether it's her heart.
No.
Well, why not?
I do believe.
So I know that this isn't like your last cardiac problems that you had, but sometimes we can have an atypical or a presentation that's not normal. This patient had had cardiac problems before, and she said that this didn't feel like anything that she's already had. Normal presentation for a heart attack would be chest pain radiating into the left shoulder or up into the neck.
She had a bypass and then she had an angio.
So I'm going to take a picture of your heart and just take a look, see what it's doing. We will do that quick here, and we'll get the rest of your medical history as well. Okay, we're just going to hold this arm straight. I'll get you to hold nice and still, okay? I'm not going to ask you any more questions. I just want you to hold still for a sec.
At 2-3 ABF. Send 2 guys back in here. The heart tracing tells me right away that the patient's having a heart attack. See, get stretchered. You need 2 lines and we gotta go. From what we can see right now, there's probably a blockage somewhere that's made your heart go real, real slow.
1, 2, 3.
So we did a heart tracing just inside the house. There is some damage being done to her heart. Looks like she is having a heart attack.
You okay? Okay. Nice and easy.
Kind of want to make things speedy, move as efficient as we can, and we're going to take her to the hospital where she can see a cardiologist.
I need that monitor right here on the bench, please.
So we're responding for an 88-year-old male. This might be some end-of-life care that we might be going to here. So this might be a little bit different of a call than we're normally used to.
It's gonna be right here. You have a palliative patient. The family is obviously upset, and they know that their loved one is leaving the house, for the last time. And so you just treat them with as much respect and empathy as you can.
Okay.
Where is your dad right now?
He's on the couch.
He has cancer?
Yes. Yeah.
Where's his cancer? He's in the bladder? Okay. And what's your dad's name? Lloyd? Hi, Lloyd. My name is Christian. Can you open your eyes? Lloyd, I'm gonna take a listen to your lungs here. Nice deep breath for me. You see patients every day, every shift, and every week. And again, nice deep breath, Lloyd. That suffer like Lloyd had been suffering, but it just doesn't ever get any easier. Lloyd, can you talk to me? No? Do you just feel weak right now? It's extremely tough to see somebody who's so sick. So in terms of treatment, from a family's perspective, what would you guys like accomplished in Lloyd's treatment?
I was caring for him at home, and I just can't look after him anymore.
Right.
I can't get him to the bed, to the bathroom.
To the bed, to the bathroom, okay.
I'm gonna help sit you up here.
Okay, there we go.
If he was wanting to be at home, or like pass away at home,
He wants to pass away at home.
it's just not in your means right now.
I can't look after him here.
The closer to end of life you get, it's down to feeding. Maybe he can't even stand up or walk anymore. Can he go to the washroom himself?
1, 2, 3, yep.
It's 24/7 care, and that can be a lot for the family to cope with.
One of the most difficult aspects is not only treating the patient, but treating the grieving family.
We're going for a fall, and we want to figure out what's the reason behind the fall.
We walk in, I can see an elderly female laying on the ground. She is very sick. She's gray, she's diaphoretic, so she's soaked in sweat, and she's very scared.
Can you tell him your name?
She looks confused, she looks dazed.
So what happened?
She wasn't feeling very well at supper time.
Okay.
So she didn't finish her supper.
Okay.
And then she go into the washroom and she was in the washroom trying to throw up. She couldn't throw up, so she come back and at the door. She like a fainted, like she was holding the door rim. And,
Do you remember what day it is today? What day is it today?
I don't know.
Do you know what month we're in?
No.
What city do we live in?
Does he have a history of dementia? Yeah. Okay. So generally, Tom said she's quite confused. Okay. The patient's dementia complicates things because although she's having pain, she can't articulate her symptoms or how long she's had them.
Can you do me a favor? Squeeze my hands. Okay, good.
How is she on a day-to-day basis, sir? Is she normally confused? Will she converse?
Is your breathing easy?
Yeah.
Yeah?
Yeah.
Okay, are you dizzy?
No.
she had no sense of time, date.
Okay.
So your tummy's the worst?
Looks like an inferior STEMI. The ECG shows the patient has a blockage in her heart. She's having a heart attack.
We're gonna lift you and carry you outside to our bed, okay?
Okay. We're gonna put this other one way up here.
I feel bad for our patient. She's confused and not understanding why she would need to go to the hospital.
Hello? Hi, my name is Alicia. I'm a paramedic.
Okay.
I'm here with your mom.
Right. Well, what's the matter? Like, what happened?
Okay, there.
She is possibly having a heart attack.
What?
1, 2, 3.
I need to ask you a couple questions.
Let's get you covered up. You must be very cold.
In the event that her heart does stop, does she want CPR done?
Yes.
If she stopped breathing, would she want to be intubated?
Just do whatever it takes.
Okay. The patient's daughter has asked for a full code, which means we'll do everything we possibly can to revive the patient. Okay, so we are a full code. Everything.
Okay.
3 AVF?
Yeah, I'm just gonna do another one quickly now.
Do you want anything?
No, we just need to go.
We want to leave the scene as quick as possible. Any other treatment can be done on the way.
How many times have you thrown up today?
None.
None. Okay, do you remember fainting?
No.
No. She's having a lot of trouble processing what's going on. You have to throw up. The patient's nauseous, and that's a symptom of a heart attack. Sheila, can we speed up, please? We need to get this patient to the cath lab to see cardiology. We gotta go hot.
Base to 28. You're responding Delta for a 74-year-old male. He is unconscious, not breathing effectively. CPR has been started.
Agonal respirations, they're 99 obviously, so CPR is in progress. We hear the patient's not conscious or breathing. 99 is the code for cardiac arrest.
Definitely.
We arrive on scene. There's several medics and fire already working the patient.
Yeah, we got it.
51.
We need to know if he's had previous cardiac events or if he has a DNR.
So I just was wondering if I could get a little bit of history of how you found.
Your epi's in. We're giving him adrenaline right now, which is our only treatment to get some electrical activity going within the heart. We have a change in rhythm. Change in rhythm. Pulses. Check his pulse.
And then I looked up and
I don't feel anything.
Okay, let's just sit him up, guys. Just sit him up.
We did CPR for such a long time, and he's such a big man, which makes our CPR not the most effective.
So Jesse, I put 2 epi in.
Lucas comes in when all of the rescuers are exhausted. Lucas is a chest compression system that takes the human error out of CPR.
So as soon as you saw him like that, that's when you called 911 right away?
We are fighting an uphill battle against what is most likely a severely diseased heart.
Check his pulse. I don't feel anything.
I have a bounding pulse.
You do?
Yeah.
Okay.
Finally, his heart is beating again, and Jesse finds a strong pulse in the neck.
So awesome.
Okay, let's get this scoop, guys.
Heart rate of 148.
I don't have it either.
72, red one.
Are we not feeling a pulse?
No.
No, he's a Sicily again.
1967, we're 99 again. We lost it.
Okay, so we're moving.
1, 2, 3.
Okay, watch. Wait.
Do you have any vitals at all?
Was a witness arrest?
Everyone has put so much effort into this call. We're hoping for the best case scenario, but realistically, it's not looking very good.
This is a messed up spot. Oh, here we go.
So when we first get to this gentleman, we see him through the glass door.
Hello.
When you look at him, his face is sunken, his bones are showing. This gentleman does not look well at all.
What's going on today, sir?
I got pneumonia.
Okay.
Can't breathe that good.
Okay, why don't you grab a seat and I'll grab a quick listen to you. The patient tells us that he's recently had a pneumonia, but the pneumonia is clearly holding on tight. I'm just going to lift up your shirt. How long have you had pneumonia? The amount of difficulty that our patient's having communicating is really signifying how short a breath he really is. I don't hear any congestion or wheezing at all. He's got a saturation of 75. We get a glimpse at his oxygen saturation at 75%. It should be around 95%. I've got that at 6, and I'm just going to vent that.
Breathe. Because of the difficulty with the patient's speech, breathe again. It's hard for us to assess the current history of the patient. Did you say you're missing a lung? What? Part of it.
He tells us that he's a long-time smoker and that he's had part of his lung removed. You couple this with the pneumonia, and no wonder he's having such a hard time breathing.
Okay, let's get you outside.
Still got to do a lot of investigating with this gentleman. It's really difficult to get a history from him because he's having so much trouble speaking in between breaths. Lung sounds are a little bit better now after a neb. No wheezing that we can really hear. He's still quite quiet throughout, but he's really working hard to breathe. We've given him some more medicine and we're going to see how he does. More testing at the hospital once we get there.
Base to 36. You're responding Delta for a 57-year-old male. He's having some chest pain, difficulty breathing. He does have a COPD history.
Anytime we get called for a patient with chest pain or shortness of breath, we want to get there in a hurry.
He's short of breath, he's got chest pain. I'm thinking he's gonna be sick. You know, time is of the essence.
Hey, this is Darren, he's 57, he's got 8 out of 10 chest pain.
It's okay.
Easy at 8 liters a minute.
The firefighters have put the patient on oxygen until we could get there to give him medication. Point to me where your chest pain is on your chest. On the left side there. You're short of breath as well? Okay. I'm gonna take a listen to your lungs again and just see. Take some breaths for me while I listen.
He's 88.
In a normal patient, we want to see oxygen saturations of 95 to 100%. This patient was 88% on oxygen. He's not moving a lot of air. He's silent in the bases. I don't hear a lot of movement, and then he's got an expiratory wheeze on the upper, I heard. We're gonna give you a nebulizer, okay? We're just getting it set up. We need to give this patient a nebulizer of Ventolin and Atrovent to open up his airway. Do you have any other medical conditions other than the COPD?
How come? I don't know.
Have you been throwing up?
Yeah.
Yeah? Okay, it's coming. It's going into you right now.
Focus on your breathing for it.
I couldn't imagine feeling the way this patient feels. You're starving for oxygen, but you can't get any.
What we're gonna do is we're gonna stand you up and we're gonna put a seat underneath your bum. You know, this guy actually can't catch his breath. So the anxiety comes with it because he's like, you're panicking. Maybe more of a COPD exacerbation than a chest pain, but picture if you were drowning. You know, like the first thing you do is like, you panic and you try to get to the surface, and then you end up using more oxygen. There's a sense of fear within him. It's compounding our situation.
You don't want that one.
We have another mask coming here for you.
Listen to me, okay? We're gonna try this mask. He's not responding to the nebulizer, so we need to try something else. It's a big mask that goes on your face.
CPAP provides continuous positive pressure within the airways, which helps keep the lungs open and alleviates shortness of breath.
We're gonna put this mask on your face, and it's got a very high level of oxygen, and it pushes it in your lungs, okay? Big breaths.
Yeah.
Patients are usually quite fearful of the CPAP mask. You're already short of breath, plus the feeling of claustrophobia. You don't want that big mask on your face.
Does it feel better? Yeah?
I guess you can't breathe. That's a reason to be anxious.
We're definitely seeing an improvement in our patient. Our treatment is helping him. His anxiety is decreasing.
So let's see. We got
How is your chest pain now? That you've relaxed a little.
So our sats are 99. His work of breathing is decreasing and becoming much easier.
That mask is really helping, hey? Yeah, good. I'm glad we tried it.
When you see this patient take a sigh of relief, you can take a sigh of relief. You know, you finally found a treatment plan that has helped this patient.
So I'm going to take a picture of your heart and just take a look, see what it's doing.
The lady we dealt with at the start of the night that had the heart attack,
You okay?
she was taken to the cardiac cath lab where she had the artery opened that was blocked and is expected to have a full recovery.
Okay, so we are charging. Just keep your compressions going. On the cardiac arrest we responded to earlier in the night.
Got it.
1, 2, 3.
We continued CPR all the way to the hospital.
Coming out, grab the side.
At the hospital, they resumed efforts, but were unable to get a pulse back.
Hi, Lloyd. My name is Christian. Can you open your eyes?
The patient we responded to earlier in the night, 88-year-old male with bladder cancer.
There we go.
Are you in any pain, sir? We transported him to hospital and he was admitted to palliative care.